As Wisconsin jumps forward to immediate reopening with some counties maintaining safer at home rules, healthcare workers stay the course, bracing for incoming patients, deaths, and the duress of the frontline care. When the pandemic first hit Wisconsin back in March, we talked with Dr. Nasia Safdar with the UW Division of Infectious Disease. This week, we want to check back in with her. And Dr. Safdar, thank you for joining us again.
Thank you.
What is your reaction to the court ruling that immediately reopened the state?
You know, I think from a public health and infection control standpoint, I think we have always advised that reopening should be a gradual, carefully monitored process. And so this goes against that.
And what do you think about that?
I think potentially there are activities as people commingle and gather that will make it challenging to contain COVID-19 in the way that we have been able, fortunately, locally and in the larger state, been able to do thus far.
So yeah, I was going to ask you if you believe that the safer at home order had flattened the curve.
I think most people believe that to be true, and I think the data on mobility and the effect of reducing mobility on COVID-19 growth rate and new cases is pretty compelling. So I think that when you have something that has worked successfully, if you do decide to de-escalate it, it should be done in a very careful, gradual manner.
And meanwhile, this will, at least so far, be done in kind of a patchwork manner with some number of counties deciding to go ahead and maintain those orders, whereas others will not. If there were to be a surge in cases as we reopen the state in this way, are healthcare workers where you are able to manage a jump in cases?
You know, I think we're much better positioned than we were in the earlier stages of this pandemic in this country, in the sense that we now know a lot more about transmission, about its impact, the populations at risk, and all those things that we really had very limited information about before. Having said that, I think while we are better prepared to manage more patients, we'd still want to avoid a surge that would overwhelm any one or more health systems.
Is the supply of things like personal protective equipment now adequate, I mean, for right now and going forward?
So it's adequate for right now. I think going forward as well in all likelihood, but it would in a bit, to some extent depend on how many cases we see and how sick those individuals are and what kind of PPE is required. I think our use of PPE has been optimized considerably, so we are in the earlier stages, conserving and reusing things that we wouldn't normally do, and that has led to us being able to keep our PPE around longer.
You've said that there are things you have learned about COVID-19, obviously, since the early days. What would you estimate is the most important thing that you've learned about this virus?
I think the fact that there is this ease of transmission from asymptomatic people is probably the most important new data that has come forward. And that suggests that, if asymptomatic carriage is the main reason or one of the main reasons that transmission is happening, that's pretty hard to contain without some of the more drastic measures like the safer at home order.
So what would be your message then to people out there in the community?
I think now more than ever, it's really important that we don't go from 0 to 100, even if the safer at home order has been lifted at a statewide level. I think people should still think to themselves, do I really need to leave the house? And if I do, what's the essential activity that I must perform? It's going to be hard to keep people at the level that we were at for too much longer. In any case, I think it takes all kinds of negative toll on one's mental and psychological health. But nonetheless, I don't think that we're at a place where we want to encourage large public gatherings and trying to go back to the way we were before COVID hit.
What about things like shopping or socializing? Are those safe in your mind?
I think I would consider those riskier than the current state. I would recommend avoiding them to the extent one can.
How important does ramped up testing continue to be?
I think testing capacity has considerably improved, and I think it's going to be really important to determine the circle of individuals who might have come in contact with somebody that tests positive for COVID. That's much easier now to determine, because we can test a much broader swath of the population than we had been able to previously.
Is plasma from recovered patients proving a successful treatment?
I think it's a potentially promising treatment. I don't think we can say conclusively that it is proving to be the case. We believe that it is. There's some small case series that have suggested improved outcomes, but there's very little comparative data. So the outcomes of people who got it versus those that didn't, is there really a compelling difference? And we're awaiting that. There's multiple studies underway, but don't know that yet for a fact.
What do experts think about how long it will be before we see a vaccine?
I think sometime next year, assuming that the existing candidates that are in various stages of development, one or more of them turn out to be promising enough to move forward. So it's a very accelerated time frame compared to most other vaccine development. So I remain optimistic.
All right, Dr. Nasia Safdar, thank you very much, and thank you for your work.
Thank you very much.